How big a problem for veterans is addiction?
Veterans, a lot of times, who have been in any kind of a traumatic situation, find ways to cope that sometimes are not the healthiest, and they need to get numb. And drugs or alcohol sometimes become a way to medicate the emotions. We are seeing quite a few who are suffering with the substance abuse, but also with PTSD or post-traumatic stress disorder, and learning to deal with their emotions along with stopping the substance abuse is a very challenging issue for these people.
Is there any particular, one drug that you're seeing veterans take?
One of the things that I have noticed is there are a lot of pain pill addictions. Sometimes that will develop because there may have been severe injuries and initial prescription to them, and the longer someone stays on them, the more they need, and then it also becomes a way of escaping the emotions, and therefore the addiction develops. Another substance is the alcohol, which has been readily available in most places. You don't need a prescription for it, and that is also something that is available when somebody is active duty in most places. And there again, through time, more and more is used, and it becomes a way to cope with what has mental health-wise been going on.
How difficult is it for veterans who come back after serving overseas to get, reacclimated into civilian life?
It can be a very difficult situation if someone has been in a combat zone or seeing a lot of trauma in their assignments. It can be a huge adjustment, and therefore sometimes dealing with families and trying to get back to what that normal is without being always on guard for, what may be coming next. Relationships with families, with marriages, with children sometimes have been very difficult to re-engage in. I myself am a veteran. I was active duty in the Air Force, and because I'm a veteran, I have been connected with the VA system here in Las Vegas, and also can help to facilitate any issues or services that clients that come here may need to be set up at the VA system here in town.
I also understand you work, at or with Solutions Recovery Treatment Center?
Yes, I'm a licensed alcohol and drug counselor, and I do assessments to determine what diagnosis somebody has, and I work with treating substance abuse issues and also some of the mental health issues that are happening with the clients. I work for Solutions Recovery, which is actually owned by American Addiction Center, and this is a very supportive program that they are providing. If there are veterans who will be listening, if you call 888-902-VETS from all over the country, anyone that is a veteran contacting that number can ask about free veterans substance abuse services for 30 days. There will be 5 veterans chosen, and that will be available through our agency.
Do the female veterans go through the same type of problems as the men as far as drug issues, PTSD, those sort of things we've been talking about?
Yes, they do. In fact, the more females that are involved in deploying to active stations, about 20% of the females who have served in Iraq and Afghanistan have actually been diagnosed with PTSD. And yes, there again, we do see a substance abuse problem that is similar to the percentage of that of the male population of the veterans.
When you look at the veterans in Southern Nevada, is there any one problem all of them seem to have?
We do see a lot of veterans who are experiencing some level of depression and high levels of anxiety, and a portion of the veterans are actually diagnosed with post-traumatic stress disorder. Of those that we see at this facility, I would say of all the veterans that we have treated here, 80 to 90% of them have severe depression issues as well as PTSD. We are very willing to engage in helping the veterans, and it is my honor to work with veterans. And hopefully this will be a facility that you know that you can get the kind of care that is helpful, necessary, and that you deserve.
Well, Mrs. Schmidt, I appreciate your help and your time, and thank you for helping us out with our story.
You're welcome. Thank you.
Have a good weekend.